So for those who've just joined, welcome to the ExpertDoc and Group Health webinar on digitizing your member enrollment and onboarding process. We will kick off the webinar in a few short minutes, just letting the last few people join. A couple of housekeeping rules at the beginning. We will save all questions until the end of the session. You can use your chat window to send me the questions or to any of the panelists, and then we'll answer them or read them through there. So we'll give it a couple more minutes and then we'll get started. Thank you all for joining. So let's kick it off with some important stuff. So I'll make some quick introductions about our speakers this morning. We have from ExpertDoc, Eric Allen, who is our Senior Health Lead. Joining us from Group Health is Jim Moore, Chief Operations Officer, and Sarah Byrne, VP of Operational Excellence, both from Group Health. For those of you not familiar with ExpertDoc, our mission is to help companies more effectively communicate and engage with their customers in an effort to help improve customer loyalty and business growth. Using our ExpertDoc CCM platform, you can produce a variety of personalized communications through the use of our customizable and prepackaged templates on the outbound and our interactive smart forms on inbound. And without further ado, I will now turn it over to Eric Allen from ExpertDoc to begin.
Thank you, Pam. Good morning, everyone. Thanks for joining us, and special thanks to our good friends at Group Health for taking some time to share their story. So really today we're talking about this digital transformation that has been occurring, and as I think everyone knows, this is no longer a luxury or an option. You have to provide a digital experience for customers, and that is going to require ongoing change. So embracing this digital movement, what does that really represent? Well, first of all, from our perspective, customers expect communication and information, products and services to be delivered swiftly throughout their journey with you. And further, they're expecting a seamless experience across all touch points. And that's really talking about, to a large degree, personalization, delivering content, information, and access to customers when, where, and how they want to receive it. And to support these needs, this movement, organizations really need to overhaul their existing business processes to eliminate manual efforts, automate decision-making and other processes, and frankly just reduce unnecessary documents and interactions that don't drive value for any party. And in the context of what you'll hear from Group Health in just a few minutes, we're really looking now at the early stage of the customer's journey as they are enrolled and onboarded as a customer. And there are some common challenges we see in many organizations. First of all, many are still saddled with manual processes, which everyone would agree creates bottlenecks and errors, which in turn just creates delays, resulting in a number of interactions with customers to complete an enrollment or onboarding process. So everyone's spending time on activities that don't really address the objectives of a customer experience effort. And this inefficiency does limit the ability to inform, cross-sell, and upsell other options and other benefits, because all of your effort is going into just getting the enrollment right. And frankly, thinking about enrollment and onboarding from a customer communication standpoint, we're really talking about bringing what was once manual and paper-based into the digital world. And there are some clear benefits to doing that. Making the digital transformation will absolutely remove cost related to inefficiencies out of your organization. You'll be able to use everyone's time more effectively to truly meet customer experience demands. And directly related to this is the use of automation to just improve processing and response times. A digital platform allows you to collect data beyond just basic enrollment at the outset of the customer's journey to be able to personalize customer interaction throughout their time with you. You can identify how they want to be engaged at various touch points, for instance. And having a digital platform ultimately helps satisfy the empowered customer's need for self-service at different points in their journey. And really today is really about our friends at GroupHEALTH, but I do want to highlight one of the many elements of our solution that is used to support this digital customer experience. We refer to this capability as smart forms, and you're actually going to see how GroupHEALTH uses our smart forms in their enrollment process, but a few ideas first. We call this Smart Forms 101. Smart forms are essentially web forms that are used to gather and submit information and documents electronically. And in the case of the enrollment process, the customer can be guided by the smart form, eliminating data entry errors and ensuring accuracy the first time around. Related to this, smart forms can be used to support customers' need for self-service, and they are able, as you're going to see, to incorporate informative media content that helps clarify, explain, promote benefits and options. Again, this is about making it easy for the customer to digest and interact with you. A few other things about smart forms. They can be customized and completely branded however you like, and you're going to see that from GroupHEALTH. The information captured in smart forms can be fed directly into an organization's core systems of record, so you can use that throughout the customer journey. And smart forms are also a great way to just capture those communication preferences at the outset. So that's just a quick overview of our point of view on going digital, especially as it applies to enrollment and onboarding. But this is really about GroupHEALTH's story. So I'm going to turn the floor over to Jim Moore and Sarah Byrne, and they're going to share a real-world story, how they leveraged going digital to transform not only the customer experience, but also enhance business processes and efficiency. So with that, Jim, I believe the floor is yours.
Thank you, Eric. Hello, everybody. Glad you could join us. I'm going to take a few minutes to talk a bit about the background of the application and how we initially developed and deployed it, and then I'll turn it over to Sarah, who will do a demonstration for everybody so you can see it in action. So our first encounter with ExpertDocs was really about we were talking to them about a different business need, mostly about publishing our contract paperwork. But as we started talking to them and learned more about their product offering, started talking about the Smart Forms application, and for us, it had a much higher ROI to deploy on the Smart Form side and really automate our enrollment process than the publication of contracts. So we're still looking at the publication side, but this was the first project that we deployed with ExpertDocs, and it went very, very well. So the challenge we had was that we're a healthcare insurance company, and we're a very traditional enrollment model where we sell our products through brokers. And when a broker would get a client, they would sign the master application or master contract, and then to get all of the employees or members on the benefit system, they would show up at the client's office with a stack of paper forms that would be then distributed to the employees, who would fill them out and return them to the plan administrator at the company. And of course, the plan administrator of the company would spend a lot of time chasing employees to get those forms. Once they were all collected, they would package them up and send them back to us, either in sometimes in fax or sometimes by good old-fashioned mail. Then our team would have to manually enter the data off the forms into our system, and which then connected them to the set up all their eligibility in the system, their claims processing ability, and all of those things that are associated with the benefits package they had. Of course, doing that was extremely manual. We talk a lot of manual data entry by our staff. A lot of headaches, both from our brokers who were chasing the forms and working with the administrators to get the employees to fill those out. It took a long time, quite often, especially when we were selling to a client that had multiple offices across the country. It took a very long time to get all the data gathered. Lots of issues with data because the paper forms were just standard forms, so they didn't have any, they would ask all the questions. So people would fill in pieces of the form that weren't necessarily related to the benefits that they were entitled to. So it caused a lot of confusion for the client, where they thought they had dental coverage, for example, but because they filled it on the form, but the employer wasn't offering that as part of the package. So it caused lots of customer satisfaction issues as well as data problems in the systems. One of the big challenges we have is handwriting and recognizing that, especially these days as more and more people seem to spend more time texting and emailing. Handwriting seems to be getting worse, which makes it hard to read. And as we're entering the data in the system, if our people couldn't figure out what it said, and they'd have to go back to the plan administrator to try and get the correct information, or sometimes they would enter what they thought was correct, but it turned out to be a misspelled name, for example. And then when that member went to go process a drug claim, if the name in the drug processing system of the pharmacy didn't match what our system was saying, it would get rejected, which again caused a customer satisfaction issue. And then, of course, people skipping data that was required, or putting in incorrect information. For example, they'd say they were married, but then didn't provide us information on their spouse, or dates are always a problem, where they enter dates in different formats, day, month, year, or month, day, year, which can get very confusing, again, back to the drug processing systems. So lots of different challenges we have just trying to get those forms gathered and the data input. Go to the next slide, Eric, please. So just an example of some handwriting challenges we have. The typical form, really hard to read handwriting. This happens to be a sample. I'm known around here for having poor handwriting, so they asked me to fill out a form as an example of what we get. So this is just a typical sample of hard to read and incomplete sections of a form that we get. So that caused a lot of issues as we were trying to put that in the system. Next slide, Eric. So our goal, as I was alluding to earlier, is really to improve the overall process for our members primarily, so that it was easier for them and faster, and that the end client experience was better, and that their information was correct, so they would not have any problems processing their benefit claims, for example, again, being at the pharmacy and having a claim rejected because the systems didn't match. Of course, being able to set up a client faster was a big benefit for us and the client and our brokers, because it was a big benefit to them to make their lives easier, so they could spend more time selling and servicing instead of administering plan setups. And the other interesting benefit for us is that because we were going all online with the digital side, we were able to start offering more information in the process. Traditionally, when a member would get that package with the form they had to fill out, we'd also insert some other information for other optional benefits, like an optional life benefit or an optional critical illness benefit. It would be another application form slipped into the package that was available to the member if they were interested, and went through the process of signing up. So one of the goals of this project was to make that easier to provide to our clients. Next slide, please. So the solution we developed with ExpertDoc was, we call it Enroll Me Online. So it really is about providing easy enrollment for our members, all online. So it's through their browser, and we also have the mobile ability, which makes it much easier and faster for the members, especially the younger demographics who are more used to doing everything on their mobile devices. The smart forms, the technology that Eric alluded to before, is really what makes the registration process much cleaner. So there's logic built into the form, business rules, so that only pertinent information is presented to the member. So back to my example about the dental, the forms are smart, and if the company's benefit package includes dental coverage, only then is the member presented with questions about dental coverage. And then there's intelligence into, and if they check off that they're married or common law, then we have to prompt them for other information. It does date verification, all those different things. There's quite a few different rules built into the form, which greatly improves the quality of the data we get back, which makes the administration process easier and ultimately a better client experience because they don't have as many setup issues. It's much easier for our clients to go through this, both from the member, just to do everything online through the product, but also for our brokers, their life is easier, for the plan administrators, and for our administration team here. Everything goes faster and quicker, so it saves us time and money, and we can spend our energy on other functions, such as servicing clients with more complex issues, and of course selling more product, versus having to spend time with pure administrative things around form processing. So getting going for our clients now is very simple. All we need is that the administration team provide us the member, so their employees' first name, last name, email, and the class of benefits that they want to put that person in. So they provide us that information in a spreadsheet, and we can get the system set up, and then the members will receive an email invite, and they walk right through the process, which Sarah will show you in a few minutes. Next slide, please, Eric. So many of the benefits we've seen already, a large reduction in labor for our team, which allows labor on the administration side, which allows us to redeploy those resources on more value-added functions. Certainly far fewer errors, a much cleaner setup program for process, I should say, for members and our client companies and the brokers. Makes everybody's life easier. Simplicity is a key theme for the client company, for the member, for a broker as well. Their lives are a lot easier when they're not chasing these forms, trying to get a client set up. And the other interesting opportunity for us is this revenue opportunity with the sale and promotion of cross-sell, upsell, promotion of other products within the enrollment process, which changed radically our uptake rate. We used to sell really less than 1% of our members would take the time and effort to complete one of those applications for the optional benefits, because it was basically a separate form. They'd have to enter all the same information again on the other paper form that would then get submitted and have to be processed again separately. So they wanted 2 or 3 of these optional benefits that have to fill out essentially the same information multiple times. It would go into the form, and then we'd have to process them and they came back here. But with the all electronic and online method, we've already captured that information once, so we basically just ask them, do they want this optional benefit, give them information about it, and if they want it, they click yes, and it makes life dramatically simpler. So we've seen a dramatic increase in the volume, where we used to be less than 1%, and now it's well in excess of 20% of the people that are picking up this optional benefit. So for us, it's a great revenue opportunity, but for our members and clients, it's a much easier way for them to get these value-added benefits than they used to be in the past. So, so it's made the whole process much simpler. One example is one of the first clients that came out of the system was a mid-sized company with about 400 employees, but they're distributed in 32 different sites across the country. Normally that would have probably taken us 6 to 8 weeks to get through the enrollment process, but because of gathering all the forms from all those different facilities. But with EnrollMe, we had over 90% of them enrolled within 6 days of going live, so it made that onboarding that client dramatically easier, and that's just one example. I think that's kind of my bit, so I'll turn it over to Sarah, who will give you a demonstration of the system.
Thanks, Jim. We're pretty excited here about what we've been able to develop with ExpertDoc, and so I'll just walk you through it from a member point of view. So as Jim said, we want the form to be smart. So what we've got is an interface with our system, and it will send out an email invitation to all the members who we want to enroll. There's a link in that email. We'll show that to you after. And then when they link through, they come to this screen and enter the username and the password that's found in that email. It's all unique for them. So we'll click on Login to get started. And as Jim said, that piece of the enrollment form before that was so awkward was that we couldn't customize it by benefit. We had to ask for all the information, and sometimes it didn't apply. So the great thing about this tool is we're not misleading anybody as to what benefits they do or don't have. So when we get started here, the first thing we show them is a welcome message to Group Health from our CEO, Matt. There's a status bar across the top that shows their progress as we go through, and we've got our logo and the Enroll Me logo here, and we can also put a client logo on if the client wants their logo to show as well. So most of the screens are pretty straightforward. We just click Next to go through. This screen is a lot of legal type words. Our old enrollment form, we need their permission to administer their benefits, and so this wording here gives us that permission. So if they don't give us permission to have access to the personal information, then it doesn't go any further. So they have to click that they accept here, and then they're given the option to move forward. So here's our member form. You can see here we're on the member information, and it pre-fills with the information we got from the client, so the name. So if they wanted to change any information here, she likes to be called Tekla Sue, then she can make corrections here if she wants to add a middle initial. And then you can tab through or use the mouse to go through the different fields. So we're going to indicate here her date of birth, and that she's a female, and her address. So excuse me if I have bad typing. So town and Ontario. So this is a smart drop-down, so if I had left that out, then you would be able to see all the provinces that we can choose from. These are preloaded in here, so we're going to say that they're from Ontario and enter their postal code. The personal, we already have their email from the client. That's usually their work email, but sometimes we might want to contact them personally, and that's if they leave and they bought some extra products from us. We want to be able to contact them if they leave their employer. So we would gather their information, their personal email and phone number here. So I'll just I'll put Group Health here, CA, and my phone number. Okay. So scrolling down a bit, we had set up our system for this class of employee that Tekla's in, that they would have health and dental. So I click yes or no for the benefits that I have, and I say here that you can only waive out of this coverage if you have coverage elsewhere. So if I do say no, I don't want health care, then right away it says, okay, you can only waive out of it if you have coverage elsewhere, and you can enter in here where your other coverage is. So let's say it's with Pacific Blue Cross and the policy number. So all the fields with a red asterisk are mandatory, and if I try and go to the next screen without filling something in, then it'll stop me. So you'll notice I haven't answered the dental question. So when I try and go forward, then it'll show me that that field is required. So I cannot tell you how many forms we get back from people who have not answered all the questions, and it's just a colossal waste of time for everybody to go back and forth, lots of frustration. So I'm going to say yes, I would like the dental, and I'll waive out of health. So I'm going to go next, and it says, are you married or in a common law relationship? So if I say no, then I can just click and move on. But if I say yes, then I'm going to ask some information about the spouse. We didn't want to fill the screen up with a bunch of fields that the person might not even need to fill in. So let's say she's married to Bob. Jones, I think was the name, and he was born in 1980. Yes, younger man. He's male, and they are common law. So if they're common law, then we want to see how long they've been together. So they got together on his birthday. And here, although there is health care offered to Tekla, the employee, she turned it down. So we're not going to ask her spouse if he wants health care because the members already turned it down. So that's some of the additional logic we have in, but he would like to have the dental care. And here's another question that we would ask. If they say yes to dental care, then we have to see, does Bob have coverage elsewhere? So if he does have coverage elsewhere, then we need to know, is it just him who's covered elsewhere, or is it him and his family? So again, those are required fields. If I try and move off the screen without them being completed, then I'll get an error message. So we'll go next. Do you have children? We include a little definition of who they are. They could be biological or adopted children, but not foster children. And we want them to list all their children. So we're going to say, yes, I have children, and I'm going to add a dependent. So here we're going to add John, their son, and he was born in 1992, and he's a male. So each of our contracts will allow coverage for dependents, but only up to a certain age unless they're a student. So because I said John was over 22 in this case, then I need to know more information about John. So I need to know whether he's a full-time student, whether he's working full-time, whether he's married or in a common law relationship, or if he's disabled. And each of these questions leads me to administer the contract differently. So if I say, yes, he's a student, then I can enter where he goes to school. He's in BC, and I'm hoping that he can finish his schooling by 2020. If I have to answer the rest of these questions because they're required, so yes, actually he is working 30 hours a week. No, he's not married, and no, he's not disabled. So right away, the system will come back and say that he's not eligible because he works too much. So if you have, according to our contract, if your dependent works full-time, they can't have coverage. So I'll say, oh, actually, he doesn't work full-time. And now he's fine again. Do we want to enroll John in dental care? So again, we're not asking for health because the member turned it down. So yes, I'll take the dental care, and now I'll add another dependent. So I'll just quickly go through this dependent. And we'll say she's a little bit younger. And so because she's younger, I'm not getting those extra questions. She's not over 22 to ask if she's a student or not, because we don't care. She's totally fine to be covered as she is. She's female, and yes, we'd like dental care for her. Okay? So when I'm finished with all my dependents, then I click next, and the system just adjusts to pick up the dependents that the person enters. So now, because I have a benefit that pays out on this policy if you die, then I need to assign a beneficiary. So we don't want them to sign up and not assign a beneficiary. So we're going to click on Add a Beneficiary. And the system can also, EnrollMe can manage whether they're actually allowed to assign more than one beneficiary. So I'm going to leave 50% of my benefits to my husband, who I think was named Bob. So Bob Jones, and he's 55, I can't remember, I think he was younger, and he's my spouse. And so if I click next now, it'll say I haven't assigned all my money away. It needs to be 100% of my money is being left to a beneficiary. So I'm going to add another beneficiary, and I'm going to leave the other 50% to them. Alternatively, I could go back and change that to 100% and leave all my money to my spouse. But I'm going to leave it to my son as well. And I'm going to say that he's only 16, and he's my child. Scroll down a bit there. Okay, because this child is a minor, then the screen has added an extra set of questions here for me to assign a trustee for them. So I'm going to assign my husband, Bob, as the trustee for the for my son. And this is just free text here, so any information they can give us for the address is helpful. So now I'm done. I'm hoping to go on. I've assigned all my money. So the next thing we have is what Jim mentioned, is an optional product. It's optional critical illness, which is a benefit that pays out if a member is diagnosed with a preset list of illnesses. So it's really important coverage. A lot of people get diagnosed with these diseases every year, and so what we did, we put a little blurb up here explaining the product, but then we embedded a video as well. So I'll just click play and see how that does. So I'm not sure if you can hear the sound, but basically the the video goes through and explains the importance of protecting your family in case of critical illness. So we've got some stats on the people who watch the video. It's only a short video, 2 minutes and 10 seconds. So we're getting really high hit rate and watching all the way through on that video. So we'll click next now that the member knows a little bit about why critical illness is so important. And here we offer them the option to buy the benefit. So they can have $30,000 worth of coverage, and we let them know that the rates vary by age and by smoker status. That's based on our contract. So based on Tekla's age and her non-smoker status, we're assuming, then it's going to cost her $8.62 per month to buy this. So we say your employer is going to take the money, and a great part about this product is that if they leave their employer, they can keep it with them. So there's also a brochure that provides more details about the product that they can click and view through there. So here we go. Do you want to optional critical illness of $30,000? And we say yes. And now we're going to confirm their smoker status. So we've assumed up here when we gave them the rate, they were a non-smoker. So if I say yes, I have smoked, then it will re-quote the rate for them right away. But we're going to say that Tekla is a non-smoker. We ask another question if they'd like to apply for more coverage. That has some medical questions, so we send them a brochure. At this point, we're going to be enhancing this, so we can do it online. But for now, we wanted to keep it pretty simple and see how we did. So yes, I'd like a brochure that would give me more coverage. Then we ask if the spouse wants coverage, and again, we're calculating the rate for that spouse based on their date of birth, so Bob's date of birth, and that he's a non-smoker. So if I say yes, I want it, but yes, Bob smokes, then it will recalculate its rate. So for now, we'll say Bob doesn't want any coverage. Maybe he's got it through his own employer. And then also, because there's children that we've enrolled, it asks if we want to cover those for a rate of $5.35, which covers all their children. So that's a great benefit, so we'll say yes to that. So this spouse and the child questions, they wouldn't be added if the member hadn't added a spouse and dependents. So we'll click on next. And this is it. I didn't draw attention to this, but as we went through, the progress bar was changed to show which section we're on. So here we are in the final review screen, and the member can go through and review all the information that they've added so far and change it right on the screen. They don't have to go back to a different section to make the changes. They can make the changes right on the screen. So once they've gone through this and said, yep, I got everything right, then they can click on the Submit button. So at this stage, we're also linked in. This Enroll.me is linked in with eSign Live. So in Canada, only certain provinces will allow an electronic beneficiary designation. That right now is BC and Quebec. So on this form, I entered that I was in Ontario. So in Ontario, we have to get the members to print out the application that they filled in, sign it, and send it to the plan administrator. We're still getting all the information as soon as they've hit submit. So I can proceed with their enrollment, sign them up for benefits, and the signing of the form is really just to confirm that beneficiary. So here we say that you're almost done, print the form, send it to your Human Resources Department. It's really important for your beneficiary, and if you don't have a printer, your plan administrator will send you one. So we'll click OK here. If it had been in BC or Quebec that the member was, then we would be directed to eSign Live, and then we would sign the form there. And then at the end, they get this completed enrollment card that looks more like a card. So I'll just click and show you that. So we'll open. And so here's something that looks more like a standard enrollment card, but it's got all the information they've entered. Again, the client logo would be here if the client had wanted us to use the logo on their form. The layout of the form changes based on what they'd entered. So here's here's our dependent, John Jones, and he's a full-time student. Obviously, there's nothing filled in for little Susie because she's too young. We've captured all the waiver information for the healthcare, for the dental, the coordination of benefits, who selected optional critical illness, and here's my beneficiary here. And then the wording at the bottom is all the wording they signed off for that gives us permission to administer their benefit. So they can print this off and sign it, but as I say, as soon as they hit submit, I have their data now, and we're quickly getting them benefits and drug cards, and so they can start enjoying the benefits of the program. So I think that's it for me. Eric, do you want to take it back?
Sure, absolutely.
So on that note,
if you just flip it to me.
Thank you, Sarah and Jim and Eric. On that note, we will now open it up to questions. If there are any, you can send them to the chat window and I will read them to the presenters.